Okay, so chapter 2, learning games. What are we hoping to achieve with this e-learning today? So we have some 6 different learning games that we're going to try for to provide practical ideas to help people make sense of pain. This is a really important thing. We're going to see today how complex pain is, but also how complex education is and how complex communication can be. So we're going to try and provide you with some practical ideas. My concern sometimes when we look at healthcare and how to teach clinicians is that we often see these very neat, tidy theories that look great in a textbook. It's a bit like when you go into a shoe shop. You see these lovely, neat, tidy shoelaces in straight rows. That's not how shoelaces work, and nor do textbooks really show us how practice works, how human beings think. How we can help them to change and provide them with hope. So we're going to try and keep this very practical. We're also going to explore an evidence-based understanding of what it is people in healthcare want from patients want from healthcare professionals. This is crucial. You know, as we said, there's sometimes these gaps between what we want and what they want. So we're going to try and reduce those gaps as we go through today. We're going to try and provide you with an introduction to teaching and facilitation skills. I often, when I'm in large conferences and small rooms on courses, I often try an experiment, and I can try it with you now, a virtual experiment. If you were to put your hand up, if you educate or advise or guide patients on a day-to-day basis, you know, do you every day in your practice provide people with exercises, teach them how to use a walking stick, how to go up and down stairs, sleep advice? I'm sure all of you are putting your hands up. Education is this huge component of what we do. If I now get you to think about putting your hand up if you're trained in education, who has a diploma in education, a qualification in education? Usually, I'm sure we tend to see very, very few hands. There's a dilemma here. We need to explore this dilemma, and maybe I'm going to introduce you today to some ideas as to how to become a better teacher, to be able to help your patients and yourself maybe as a learner. We're also going to sort of try and help people make sense of pain perception. Pain perception is hugely complex, and it involves philosophy, it involves sociology, it involves psychology, it involves physics, biomechanics, anatomy. So pain perception is this hugely complex issue. And I'm sure some of you will have heard patients ask you, are you trying to say this is all in my head? We're going to explore that question. I think that question is the question of our time. So how do we help our patients to feel believed? Because we know that patients, if we look at the research, people in pain don't feel believed. And it's hard for us as clinicians to try and ensure that they feel believed and validated. Social legitimization is a huge part of what we do as healthcare professionals. We're also going to look at considering the role and application of pain education and pain science within sport. I did some work a few years ago with the International Olympic Committee, and we've written some articles, as you've seen in the previous slides. So I think it's really important to think about not just pain for people with fibromyalgia, people with long-term persistent low back pain, but what about people who are active? What about the weekend warriors who like doing triathlons, who are struggling with pain? How do we help those people? Because we have to consider these things. And most importantly, we're going to start to look at how do we try to give you some practical ideas to help people move from hurt to hope, from pessimism to optimism. I think that's essential. So we're going to look at 6 different learning objectives. Now, obviously, in this e-learning, it's very different to coming to a physical course. So I'm hoping that this e-learning is going to be part of your no pain experience, not the whole experience. You can see here from this pie chart, we only know a very, very small amount of things. So it would be very wrong to think that because you've done this e-learning that you've ticked the no pain box, that you now have all of the information. I'm going to give you a small chunk of what we cover in the course. So there's a small chunk of what you know, there's a very large chunk of what we don't know, and actually if you look at this pie chart, there's a huge amount of what we don't know that we don't know. So things that we're not even aware of. For example, today I might switch you on to some ideas about education that you've not even considered. So we're never stopping learning, we never stop reflecting. We learn from experience, we learn from reflecting on experience. So to give you an idea as to what you would learn on a no pain course here in France or anywhere around the world, it comes in two different parts. Part one, day one, we start to look at what is pain, how do we help people make sense of it, the neurobiology of pain, the practical application of neurobiology and neuroscience. In day two, we start to look at language and communication. How do you help people express their experience of pain? We explore not our metaphors as clinicians, but patients' metaphors. People in pain use metaphors all the time. We need to get better at helping them use those metaphors. So this is something we don't cover today. We're also going to start looking at pain and psychology, something else that we're not going to cover in this e-learning. So we look at the practical application of things like CBT, acceptance commitment therapy, cognitive behavioral therapy, mindfulness, cognitive bias modification, which is essential. So we need to start thinking about these things. Mindfulness, these things are crucial for physiotherapy. Speaking about psychology, colleagues of mine who work in psychology, who are psychologists, often say to me, you know, you're really fortunate, because I wish as a psychologist that I wish I had skills of a psychology to help patients change their behaviour, but without my patients knowing that I'm using psychology. And that's where we're perfectly placed as physiotherapists. We can use psychology, but it's talking, it's chatting. It's interesting, in the UK, there's a move towards teaching hairdressers and barbers how to have psychology skills, because what do people do when you go to see a barber or a hairdresser? You start talking about your problems, you open up. So I think this sort of shows a very good point. We need to become much better at using psychology without people in pain understanding that it is psychology. It's just talking, it's just chatting whilst we're doing exercise or hands-on massage, manual therapy, whatever it is that we're doing with our more traditional physiotherapy skills. So in day 3 on the part 1 course, we start to look at, once you've helped people make sense of pain, now what? What are the options? We need to explore what they can do. Can they start to exercise? If so, how do we do this? Do we look at graded exposure, gradually exposing them into confidence to movement, which again is a physical application of psychology? Or do we start to flood them? Do we need to give them a big challenge and a low support? Do we need to give them a low support and a big challenge? This varies. The most important statistic in healthcare, N equals 1. It's about that one individual. It's not about big populations. It's about the patient that's in front of you. So being able to modify those exercise programs based on that individual, that's crucial. Then what you start to look at is case studies. So you get to spend the afternoon of day 3 before you leave to test your knowledge. We're going to do some of this in this e-learning today. I'm going to say, how would you help this patient with the things that we've been covering in this e-learning? So this is essential, starting to keep it practical. In the part 2 course, we begin by looking at how we can develop our skills as teachers, how we can start to learn more about communication and about education. But also, when I do the part 2 course, it's normally 1 year after people have done the part 1 course, the level 1 course. So you have a year's worth of experience with patients, and you get together as a group of 30 people and reflect and change the way you do things, and you help each other as learners. Peer learning, supporting each other, clinical companionship is a crucial part of attending a course. Then we start to look at, in day 2, we start to look at facilitation of education. And we spend the entire day looking at how do you develop your teaching skills. Today in this e-learning, I'm going to give you this much. I'm just going to introduce you to these ideas. You spend an entire day exploring these things. All the skills that, as a teacher, you have, but as a clinician, we don't learn these skills. These skills are merely assumed quite often. So we don't know what to do when we see patients who are confused or maybe they're bored. How do we get them engaged? So we'll be looking at those things. And in day 3, we'll start looking at self-efficacy. And we start looking at how do you build resilience? How do you make people more confident and say, I've got this, I've got control, I can do this. Then we start looking at shared decision-making, helping patients to understand that they have decisions to make, they have options, and we can share those options. We can provide them with some evidence and ask them which road they would like to take. And then we start to look at case studies, particularly with relation to elite athletes in elite sport, which, as we said, is essential, crucial.